Okay, it's a little bit after, so I think we should get going. So welcome, everyone. My name is Cindy Steinberg, and I am the Director of Policy and Advocacy for the U.S. Pain Foundation. And I'm going to be joined today by Elizabeth Tapia, who is the Health Policy Aide for Congresswoman Yadira Caraveo, who is a pediatrician from Colorado. And we're going to be talking about the Advancing Research for Chronic Pain Act today, which we're really excited about. So can I have the first slide? So this bill, the Advancing Research for Chronic Pain Act, was originally introduced in the Senate as 2922 and later in the House as 7164. And here is a bit of an overview of what we're going to cover. So what is the bill? Why does it matter for people with chronic pain? How did it come about? And what you can do to take action, because we're having a virtual advocacy tomorrow, and we want to give you all the tools you can to be an advocate about the bill. So next slide. So first of all, this bill is a federal bill, and it was introduced in the U.S. Senate September of 23, so just last September, by a bipartisan group that included Senator Casey, Senator Blackburn, Senator Kane, and Kramer. And it was led by Senator Casey, and you'll get much more detail on that later. And ultimately, it was included in the Senate Support Reauthorization Act in December. And so now the bill is incorporated in a much larger bill, which has a much better chance of moving, and we'll talk about that. And then it was introduced in the U.S. House in January of this year by Representative Caraveo, who I mentioned is a pediatrician from Colorado, and Representative Zach Nunn, who's from Iowa. Next slide, please. So what would this bill do? So in overview, it would basically analyze and report and aggregate population health data on chronic pain for pain as a whole and for all the known pain conditions that yield, that end up in chronic pain, whether it be from a disease or an injury, et cetera. But, conditions that we know of. It would identify and fill gaps in research data that we don't currently have. It would develop standard definitions in collaboration with stakeholders. So, the definitions that are used in making numbers and calculating numbers in the information would all go to a panel who would decide what definitions should be used. It would translate research into clinical tools and resources, and then all this information would be aggregated on a public website or some sort of public information hub. And it would require annual updates to the information. So next slide, please. So what specifically would this require? So as I mentioned, it would be for chronic pain in general, and then for all known pain conditions. So the incidence and prevalence, and these are two different things. Prevalence is just the sheer number of people or the proportion of people in a population that have a particular characteristic. And incidence is the number of new cases per year. Demographics like age, race, gender, and geographic location, for example, whether they live in an urban environment or a suburban environment or a rural environment. Risk factors, so what are factors that may lead someone to develop a particular chronic pain condition, genetic factors or environmental factors. Diagnosis and progression markers. Direct and indirect costs, which would be really wonderful and huge for us to have the costs of chronic pain to the economy, to our healthcare dollars that we spend. It would require detection, management, and treatment data, and also treatment data on co-occurring conditions like anxiety and depression, which are often common with chronic pain. Would require utilization of medical and social services information, and then evidence of effectiveness of evidence-based treatment approaches, which would be really helpful to have. So what conditions are affected by and improved by what treatments. Next slide, please. So why does all this information, collecting this data, matter for people living with chronic pain? First of all, it would give us accurate, reliable, and updated numbers to cite when we're making the case for why we need greater resources, why we need more research, why we need improvements in care for the huge population that it impacts. So for example, if we wanted to know how many people have diabetic neuropathy in the US, we have no idea. We don't collect that information now at all. If we wanted to know what is the onset of age, what is the age onset when diabetic neuropathy appears, and what is the relationship between disease progression and pain? So for example, when somebody has diabetes for a certain number of years, are you able to predict whether they will end up with pain and whether it will be chronic? So the data is important for knowing even individual pain conditions and all the information that we could use in knowing that to create better policy. Another thing I would give us example of, I'll give you an example of, is in chronic headache or migraine. There's a widely cited number in the headache community, 40 million prevalence of migraine. And I looked that up, and it was coming from one particular study in 2018, cited here, Birch, Rizzoli, and Loader in 2020. And is an answer to the question, during the past 3 months, did you have a severe headache or migraine? And if you answer that question, yes, that might have been the only headache you have all year. And so the 40 million number is really an acute pain number, not a chronic pain number. And we're really interested in chronic headache because that's what's incredibly disabling when somebody has a headache, a severe headache or a migraine every day. So I could only find one study that was done in 2012 looking at the question of chronic migraine. And basically that found 0.91% of American adults live with chronic migraine. And that was in a study conducted specifically, that was a study conducted specifically to answer these questions. So it was not a huge data set like the National Health Interview Survey is that we would base information on. And basically 0.91% is 2.3 million people live with chronic migraine. But that's a study from 2012, which is more than a decade old. It doesn't account for new conditions that might lead to chronic severe headache, like long COVID. It doesn't count non-migraines, but apparently that could be incredibly severe, like cluster or hemiplegic headaches. And so, that particular piece of information could be much improved if we had this kind of data. Next slide, please. Another reason why it's really important is because big numbers get media attention and really raise awareness of the scope of suffering and the loss of productivity. So for one example, with a lot of work with Congress, we got CDC to produce an MMWR, which is a journal of the CDC. It's called Morbidity and Mortality Weekly, that comes out every week. And in April of 2023, they released a report on pain. And this showed that 51.6 million Americans live with chronic pain, and 17.1 million American adults have high impact chronic pain, which is pain that impacts your ability to function on a daily basis. And those numbers are huge numbers. And most health policy writers in the US pay attention to what the CDC data says. And so in the 3 days following that one report, I tracked where this showed up. And these are major publications. So it was in the Washington Post big numbers column that said, did you know that 50 million Americans live with chronic pain? Fortune, in the New York Times, in Stat News, even the Weather Channel. So this was carried in major outlets, publications, and it just has a huge impact. We'll never get people to really recognize the severity and the impact, the burden of chronic pain, unless we get a lot of publicity like that. Next slide. It also will help us identify and quantify the consequences of chronic pain. So as we know, chronic pain can really destroy people's ability to function. You might be able to not concentrate with chronic pain. You often have the inability to take care of your family. People can't sleep. Oftentimes people can't work or can only work part-time because the pain is so debilitating. And so documenting this data can really help make the case for a number of things. One being Social Security disability. People with pain have a hard time getting approved for disability. Not only Social Security, but long and short-term disability because they're living with an invisible illness. But if we were able to document exactly what the consequences are with data like this, I think it would be a lot easier to make the case to Social Security that somebody with a chronic pain diagnosis should be eligible for long-term disability. Next slide, please. Also, it'll help us pinpoint disparities so more can be done to focus resources. So accurate numbers in the prevalence of chronic pain among specific racial groups, ethnic groups, indigenous groups, traditionally disadvantaged groups like LGBTQ individuals will really make the case for directing more resources and improving access for these groups. So it's really critical for us to have this information, to change policy to help people that are now being helped and are struggling with pain disproportionately. It'll also identify better for us who's at risk for chronification and co-occurring conditions, which is a big problem living with pain. Next slide, please. Cost and health utilization data is invaluable in making the case for better resources, for improved treatments, and to payers as well. Chronic pain has been documented to account for a high proportion of emergency room visits. And people with pain typically go to at least 4 or 5 doctors. I think that's also been documented in journal articles before they even find help or find a good diagnosis, which is incredibly costly. So if insurers refuse to pay for the expense of a new treatment, and you really look at the dollars and cents here and can make the argument, would you rather them visit the emergency room 12 times a year, at a cost of God knows what an individual emergency room visit is, $10,000 these days. So, would you rather spend $100,000 insurer on that we can document that you've actually spent for this individual, or would you rather pay for an innovative treatment that perhaps is much less? It also will give us much better data on the effectiveness of treatments, which will for sure enable more precision treatment plans, more individualized and tailored treatment plans. Next slide, please. So how did this bill come about? I have long had an interest in population health data on chronic pain for all of the reasons that I just talked about. I think it's really essential in raising awareness that people still don't know about the scope and burden of pain, and in the importance of the government doing more to address the number of people that are living with untreated or undertreated pain. And so myself and a longtime colleague worked to create a first draft of this bill in 2018. We knew that the Support Act was being worked on, and we were going to try to get this into the Support Act. But we were unable to. We were kind of late with it, and so we didn't get it in there. But I resurrected the bill about 2.5 years ago and thought I gotta give this another try. And so myself and also two coalitions I work with, the Pain Care Coalition Work Group, which is a small federal work group I work with, and also the PAPR, which is Providing Access to Pain Relief Coalition, also helped me bring this bill to 18 different offices. I kept a record of how many offices I actually went to educate them on the bill and why it was important. And one of those was in February of 2022. I met with Kate Samuelson, who was a health aide to Senator Casey. And she expressed an interest in the bill and said that she would bring it back to her team. And so soon thereafter that, I heard from her again, and she was contacting me to tell me that she had a research fellow with a background in pain, which was like fantastic. And I just want to give a shout out to Lindsay Yesick, who was a PhD in pain neuroscience, who ended up working in Casey's office, which was just luck, because Kate was interested in it. She got the team interested in it. And then Lindsay brought her interest in the bill as well. And so they worked to really develop the bill with CDC and get technical assistance and stakeholder input. And they were kind enough to share drafts with me along the way for input. I know they shared them with other groups because I heard from some other groups about who they shared it with. And that is the bill that we ended up with now. Next slide, please. So I often talk about how much persistence and patience you have to have with advocacy. And so with a combination of patience, persistence, and compromise, which happens all the time, it's the half a loaf is better than nothing in politics. So the bill that we actually had drafted and brought to various offices was much more extensive and probably more costly, because I wanted longitudinal data. So it would require a registry that we have for many other diseases like cancer, that would track the same group of patients over time, which is very helpful for making trend predictions and others. But that was cut out of the bill. But the bill is still very strong and has a lot of the things we did want. So Kate and Lindsay sought some bipartisan co-sponsorship, and I met with a lot of offices to try to help with that. And then in the late summer of 2023, Kate contacted me to say they were working on introducing the bill, which was just really thrilling for us at US Pain Foundation. And so the bill was introduced September 26th, and there's an example of some of the press releases on the screen in Senator Casey's website, which you can see. Next slide, please. And lo and behold, a really great opportunity arose in the Senate, which was after the introduction of the bill in September. The Senate had not yet taken up the Support Act reauthorization. So the Support Act was a large bill that was passed in 2018, largely it was a second large opioid bill that Congress passed. And it had a number of pain provisions in it. There was definitely the recognition that pain was part of the picture when you're looking at what to do about opioid addiction and substance use disorder. And so that bill, we heard, was up for renewal because it was expired in 5 years. The bill is mostly services for people with substance use disorder. So there's a lot of grants for recovery programs and grants for medication-assisted treatments, et cetera. But it did have these pain provisions. And so knowing this was coming up for reauthorization, I'd heard that they were going to have a hearing on December 12th, and I got that information like in November. So I just started meeting with as many offices as we can, particularly on the Republican side, because with the bipartisanship in Washington, knowing that Senator Casey is a Democrat and he was going to introduce the bill possibly, at a markup, we really needed Republican support. So I met with Senator Collins's office, Senator Murkowski, Senator Mullen, particularly these people, because we had gotten that data in April of 23, and it showed, for example, that individuals that are indigenous or indigenous groups had twice the amount of pain as a Caucasian, which was a interesting and surprising finding. And so, Alaska Natives are big and are a big part of that, and that's Murkowski's district. Mullen is the Oklahoma senator, and clearly Oklahoma is probably the state with the most Indigenous Americans in it. And so we met with them, Romney, also Senator Cassidy's staff, Senator Braun and Senator Budd. All these people are on the HELP committee. And so we had heard this rumor circulating that Casey was, and then he wasn't going to introduce this as an amendment. And there was a whole lot of, discussion about what amendments were going to be introduced at the markup and what weren't. And the markup is when a committee considers, sort of the final work on a bill and decides what's going to be in the bill and what's not. So I reached out to Kate about that and heard that it was just a rumor. And so, we had a plan that Senator Casey was really going to introduce it as an amendment. And sure enough, he did. So this was on December 12th at the meeting where the HELP Committee took up the Support Act. Senator Casey introduced it as an amendment, and then the way they decide what amendments get put into a bill is to take a vote. And all the Democrats voted for it, as we expected, and then 3 Republicans did, Collins, Murkowski, and Romney. So it passed, which was really great. And I think without doing all that education of those offices about why this was really important, that wouldn't have happened. So I was really happy that Collins, Murkowski, and Romney voted yes, since it passed. And the amendment then was incorporated into the Support Act on the Senate side. And so that was great because that was reported out favorably from HELP. So what we're doing now is we're waiting for a floor vote on support. Of course, with all that's going on in Washington, especially now, especially since yesterday, all that's going on in Washington, who knows when these might get a vote, but the thought largely is that Congress is in session now and probably for another week and a half. And then August 1st, they're out. So, and then they're back short time in September. So probably this would, if the Support Act gets a vote, it might not be until till the lame duck session, which is after the election. But the Senate could take a vote anytime just on their version of the bill. I'm talking about the full bill. So next slide, please. One really neat thing we did was have a recording of Senator Casey introducing the amendment. And luckily, we got this working. And so we wanted to play this for you. It's a 3-minute piece of what Senator Casey said about the Advancing Research for Chronic Pain Act.
Mr. Chairman, thank you very much. I wanted to speak on my amendment that I'll ask for a vote on. It would add it's Casey 1. It would add the Advancing Research for Chronic Pain Act to the legislation. As we work to prevent substance use disorders, it's important to consider the substantial impact of chronic pain throughout the country. We're told that 1 in 5 adults are living with chronic pain. Many have pain that significantly impacts their ability to work. We're told that 50 million Americans live in pain either daily or nearly every day. Chronic pain stems from many underlying conditions and sources. Those suffering include people with pain from conditions like, of course, cancer, sickle cell disease, multiple sclerosis, and other chronic diseases. Beyond the significant emotional toll of the pain, it's very, very costly. In 2011 report from the Institute of Medicine, now that we refer to as the National Academy of Medicine, estimated that between healthcare costs and lost productivity, just those 2 categories, the annual cost of chronic pain was up to $635 billion. And of course, that estimate was in 2010 dollars. Despite the massive social and economic costs of chronic pain, we lack large-scale data that's needed to fully understand and develop better approaches. Senator Kaine and I have filed an amendment to address this. In September, Senator Blackburn and Senator Kramer, with Senator Kramer and Senator Blackburn, we introduced the Advancing Research for Chronic Pain Act bill that would improve data collection on chronic pain and create a centralized chronic pain information hub to aggregate the data and actionable information for clinicians and scientists. The bill would help move chronic pain research forward so we can better serve more than the 50 million that I mentioned. We cannot afford to neglect this important issue. I thank my colleague for working with me to bring forward a bipartisan proposal to respond to the needs of people experiencing chronic pain. With that, Chairman Sanders, Ranking Member Cassidy asked for a vote on the amendment. I would like to comment. I'll comment later on other aspects of the hearing.
Further discussion on KC1. In my view, we need better data on who is experiencing chronic pain, what services are being provided, and whether our treatment options are effective. I support the amendment. Senator Cassidy.
I appreciate Senator Casey's goal of better understanding and addressing chronic pain as a means to prevent opioid dependence. I'm told that HHS is already doing this. The amendment, though, would create a new program which we've not had a chance to consider. For example, what is HHS already doing? We've got government bureaucrats stumbling all over themselves. And so before we know actually if we're already doing this and the degree to which we are and current effort, I will oppose, but look forward to learning that at a future hearing. And hopefully if it's not duplication, support, and if it is duplication, we just need to focus our dollars where it should be used.
Further discussion on KC1. Okay, I think we have.
So it cuts out there, unfortunately. They do a roll call vote, and so you can hear who says yes and who says no. So those are kind of really neat to hear that. I hope you enjoyed that. Senator Casey did a great job introducing the bill and introducing the issue, and we have a lot to thank him for. If you're from Pennsylvania, he's up for re-election, so we definitely want him to get re-elected because he clearly supports people living with pain. In any case, I think you heard Bernie Sanders there saying, yes, he thinks it's important to do this as well. So that was great that Senator Sanders said that. Unfortunately, then you heard the ranking member of the committee. So Senator Sanders is the chairman of HELP, but the ranking member of the committee was Senator Cassidy. And we had prepared Senator Cassidy's staff. Unfortunately, they didn't prepare him. And he incorrectly said that this data is already being collected. This data is definitely not being collected. I've been working on this for more than 10 years, and I know that this data is not being analyzed. I mean, there may be data lying around in different data sets, but it's not being put to work the way we want it put to work. It's not being analyzed. It's not being reported. It's only reported when we kind of force them to report it. So sadly, he got that wrong. And because he's a ranking member, we really have to thank Romney, Murkowski, and Collins, because once a ranking member on whatever party side it is makes a statement, most of the members go along. But in this case, the three of them didn't go along, which was great, and their staff really prepared them. So that's why it makes a difference for us. I hope you saw how important it is to educate offices on the importance of our work on chronic pain. So next slide, please. So the House had already passed their version of the Support Reauthorization Act. The Energy and Commerce Committee, which is the health subcommittee in the House, had already had a field hearing on support and had favorably recommended the bill out in July of 2023. So that was well before Senator Casey introduced our bill. So we missed the introduction and missed getting it into the House side. So right now, the bill is incorporated on the Senate side into the Support Act, but not in the House. So strategy-wise, it would really be great to get our bill introduced into the House, because it would be really good for members to know about this bill and for the bill to have support in case it goes to a conference later on. And in that case, the Senate and the House together, or whoever is designated to work on it, from the House and the Senate, work on a bill and produce a final bill that gets voted on. So, soon we began looking for co-sponsors because we thought that was a really good idea. And then soon thereafter, Kate emailed me and wanted to chat. And what she wanted to tell me is that there was interest from Representative Dr. Caraveo, who is a pediatrician, as I mentioned, who's from Colorado, in the House, and that her office had contacted Kate interested in the bill. Next slide, please. So we are lucky today to have Elizabeth Tapia joining us. And Elizabeth is the health policy advisor to Congresswoman Caraveo. Elizabeth has a Master's of Public Health in health promotion and disease prevention. For the Congresswoman, she focuses on healthcare and healthcare drug pricing and accessibility, also investments in health research. She's also a certified health education specialist, and I'm delighted that Elizabeth is able to join us today because I got introduced to Elizabeth, and it turns out that she was the one that actually found the bill for the Congresswoman. So tell us about it, if you would, Elizabeth, and welcome. I'm so glad you could join us. How did you find this bill, and why did you think it would be good to get involved?
Yeah, of course. Well, thanks so much for, inviting me to speak here at this webinar, Cindy. Yeah, happy to kind of dive in a little bit into the bill, or, why the Congresswoman got interested, and kind of how we came to be leading it on the House side. So like you mentioned, the Congresswoman by trade is a pediatrician, but, falling under the larger umbrella, she is a physician. She went to medical school, fully understands a lot of the issues that kind of go outside the scope of pediatrics. And so in particular, chronic pain was something that came up, in my conversations with her, especially because, over 20% of the US population has some type of form of chronic pain. And I think it's become very normalized without having the proper resources dedicated to kind of understanding and characterizing pain, especially to help us figure out different strategies for pain prevention and management. In particular, in our district, the Congresswoman represents Colorado's 8th Congressional District, so right outside of Denver, kind of northeast of Denver. And so our district does have, we do have many constituents with jobs focusing around physical labor. So, farmers, ranchers, people that are very susceptible to developing chronic pain. And so that also felt particularly relevant to us and our constituents, which was another reason why the Congresswoman wanted to look at different ways to support people living with chronic pain, and doing anything we can to better, promote research and any type of increasing resources in the space. And I think on top of that, the Congresswoman has always been really an advocate for increased, science and medical research. And just given how prevalent pain is across the lifespan, she felt it was important to address this issue, especially since there hasn't been a ton of legislation kind of targeting specifically chronic pain. And so in particular, like you mentioned, I had reached out to Senator Casey's office because I had seen this bill on congress.gov. And it really aligned closely with what the Congresswoman was looking to do in the space. And so it seemed like a perfect opportunity to reach out and see if they had, a House lead on the bill yet. And luckily at that time they didn't. And so we were able to reach out and kind of showcase, our support and why the Congresswoman felt was a priority. And luckily they were really on board with us, taking on the bill and introducing it, which is great. And I think, one other thing I'll mention is we really wanted it to be bipartisan in the House side as well. Because the Congresswoman, we felt it was a priority. It was important to show that it was a priority for both political parties, or, regardless of where you fall across the political spectrum. Pain is an issue that's not, tied to any political party by any means. And so we wanted to make sure that, we showed that it was a bipartisan priority. So, we reached out to Congressman Nunn of Iowa, and he was really receptive to the idea and agreed to co-lead the bill with my boss. And so that's kind of the everything kind of leading up to the bill and what we've been able to do so far.
Thanks so much. Thanks so much. I am so glad you took the initiative to reach out and get this bill. And you're absolutely right. We say pain doesn't discriminate. It affects, whether you're, Republican or Democrat. And so it's a bipartisan issue. I know I'm not Senator, but Representative Nunn's aide had told me that there are a lot of elderly people in his district, and he does hear from them that they have chronic pain. So thanks so much on that. So next slide, please. And you'll see what Elizabeth's work did. So this was the announcement. Congresswoman Caraveo leads a bipartisan legislation to advance chronic pain research. So that was the press release on Congresswoman Caraveo's website. I'm sure Elizabeth worked a lot on that, which was great. And she kindly asked me for a quote. So we were just thrilled that she introduced it. And this was in January, the end of January of this past year. Elizabeth, also I wanted to ask you, well, let's go on to the next slide and we'll talk about our ask. And I wanted to ask you your ideas for this. So, what can we do to take action on this bill now that, we have it introduced, we have it on a large piece of legislation on the Senate side. So 2 different asks on the House and the Senate side. Most of you, I think, know what that means, but an ask is, what is it? Why are we contacting them? What do we want your House member or your senators to do? So in the House, we're thinking that what we'd like is co-sponsorship. So we want more people to put their names on this bill and to show that they support the bill. And so the question to you, Elizabeth, is why is that helpful? Tell our advocates why it's really helpful to have others co-sponsor the bill as well.
Yeah, definitely. I think that co-sponsorship of a bill is helpful for many different reasons. One of them being that, it helps educate members, I think, about how prevalent certain issues are and things that you typically don't think as affecting your constituents, until somebody comes to you and tells you about a bill that actually is really relevant to people in your district or people in your community. And so I think that asking for co-sponsorship and showing to members like, hey, this issue is actually really relevant to your constituents, the people living in your district, is one way to kind of show them that this is a priority. And so for members to co-sponsor, it'll show that for, that office is also a priority, that they, listen to their constituents and chose to, support the legislation that they're asking. I think another thing to bring up is that, oftentimes for bills to get consideration on the House floor, they have to reach a certain number of co-sponsorships. So I think the number might be around 290 or so. And so once, I know this bill has a long way before it reaches that, but for bills that, have a lot of co-sponsors, they might be more likely to be brought onto the floor for vote consideration. So really it's important to co-sponsor bills just to build up, garner that support and build up momentum, for the bill and what you're trying to accomplish through it. And so really, it hits a couple different areas as to why it's important, but I really think in terms of educating the member of Congress as to why it's important, and then also just trying to get as many people on the bill to eventually kind of help promote it up and get it more recognition to eventually bring it for a vote.
Thanks, that's great. I hope it motivates more people to get involved in our advocacy day tomorrow and to ask all their representatives to co-sponsor the bill and educate them on why it's important. And what advice would you give our advocates on how to persuade their representatives to sign on to the bill?
Yeah, I think I would say, really showing or, talking about your personal story or narrative. I think, of course, like data and research is important too, but I don't think that they have the same effect as actually sharing your own personal story, because everyone's story is very unique and, pain affects everybody differently. And so I think being able to best persuade representatives or, their offices is really to show how this issue is affecting real people, people that are living in their districts or in their communities. Because, it's not just, pain, obviously there's increasingly high numbers of people living with pain, but each number is somebody with a unique story and a unique way that pain impacts their daily life. And so I really can't emphasize enough how important it is to talk about your personal story and why it's really important that your representative can co-sponsor legislation or support legislation that will support you. And so really just having to reiterate the point that any personal story is the most, I think, in my opinion, impactful way to persuade your representative to best support you.
Thanks. I think that's really good advice. We tell people all the time, tell your own story. It's really powerful, and it really brings out the passion in people for why they care about an issue, and will help your legislative aide or a representative remember you and remember the issue of why it's important. So thank you for that. Elizabeth, I'm wondering if you have more time to spend with us or if you need to leave soon. Any sense of how much longer you would have?
Yeah, I do have to hop off in a bit for a meeting. I have it too, but happy to stand for a couple more minutes in case I can answer any questions or be helpful.
Okay, great. Thank you so much. Thanks for joining, and I'm really appreciative of the time that you've spent. And I will tell people, if you have questions, put them in the Q&A, especially if questions for Elizabeth, and we'll try to take those questions first, if she's able to stay on. So if you can hang on, I think we'll be able to get through the rest of what we have, and then people will be able to ask you questions. But if you have to leave, feel free to drop off whenever you need to. Next slide, please. So I mentioned that our asks are different in the Senate and the House. In the Senate, we already have the bill in a larger bill, which is great, but we don't have a floor vote on that bill. So after a bill gets recommended out of a committee, we need to have a floor vote on it, and the Senate would need to pass it. I think if we got the floor vote, the Support Act would pass. It was very popular and bipartisan when it originally came. So our request is going to be for your senators to ask leadership to get a floor vote on the Support Reauthorization Act. All offices will know what the support bill is and what the Reauthorization Act is. It was a very well-known bill. And so that would be our ask on the Senate side. And if you happen to live in New York or Kentucky, your senator is in leadership. And so the ask to Senator Schumer is going to be to please take a vote, a full vote on the Senate Support Authorization Act. Same thing for Senator McConnell. Next slide, please. So US Pain is going to make this really easy for people to take action tomorrow. And you will get an email since you registered to get on this webinar. You'll get an email that will have all the information that you need. Also, you can visit US Pain's website at 12:01 tonight, because this is going to be active for 24 hours. So it's all day tomorrow where you can take action. And there's different ways that you can participate. One is through email. And so when we send you the email, there will be an option for email, calls, or social media. And you can do all three or any of them. And the email will have a pre-written letter in it that would go to your senators and your representative, and it will be a different letter for the House and for the Senate. And you can also personalize that. And so if you've interacted with these software systems before, it's totally simple to do it. If you choose to just send it as is, all you do is click a take action button. If you want to personalize it, which would be great, as Elizabeth said, it's persuasive to tell your story. And so if you can concisely in the letter tell your story, you can put that in wherever we indicate, or wherever you'd like to modify the letter. The other thing you can do, which is even more powerful, is calling your senator or representative's office. We will have a sample script that has what you should say. We have a one-pager that really describes the bill that you can just send or use in your call. And then the tip for after you speak with somebody in the office is to get their name and their email and follow up by saying, I'm glad we talked about the bill. This is what we'd like you to do in the Senate or the House. And in this case, I'm giving you an example. I gave you the example of a senator would like you to ask leadership for a full vote. We also have pre-drafted social media, so tweets that you can tweet at your senator or representative that'll lay that all out for you tomorrow. And there's a graphic of even what this is going to look like. Next slide, please. So, wow, we actually really did get through everything. So we're happy to take people's questions, and I am getting some questions here. So just put your questions in the Q&A and then we'll find out. And so let's see. I don't see any right yet. Okay, for Elizabeth, is it more valuable to get Republicans on board in the House as co-sponsors or just speak to whoever our own representative is?
Yeah, no, that's a great question. I think I would say, it's important to reach out to your representatives. I think being constituents, being a member's direct constituent, is really helpful for trying to make the case for them to get on the bill. As of right now, it's currently the congresswoman and then Congressman Nunn. And so I don't think there's any, there hasn't been like more of one party or the other on the bill yet. So really just kind of reaching out to whoever your own representative is. And then, going from there, I don't think we have to kind of aim at one party or the other per se. Just kind of doing a wide net based on just whoever your direct representative is.
Great, great. Thank you. Here's another one for you, Elizabeth. Who should people try to talk to in a representative's office, or how do we find the right person to talk to? Another good question.
Yeah, definitely. So in this case, since it's like a healthcare related bill, speaking to the staffer that covers, healthcare issues would probably be the best, way to reach out to them. And typically, if you call the office or just send an email to them, they'll be able to kind of point you to the best, point of contact in the office, so that you can maybe reach out, with your email or reach out to set up, a meeting if you're advocating for other, either for the bill or just other issues as well. But in this case, I'd recommend the healthcare staffer.
Great, thank you. Thanks a lot for that. Another one for Elizabeth. Any other tips for how to best convince our reps that this is really important?
Yeah, definitely. I think one other thing I would say, I know I mentioned, talking about your own personal stories and, how it affects you on a personal level, but definitely, if you're able to talk about maybe if you have any on the data side of things, if you have any data on how many people in that specific state or district are impacted, that's also really helpful for making the case, to those offices that, hey, X amount of people are actually living with this issue. And so, it's more prevalent than we thought, or, more, it's a bigger issue than you would expect. So really just anything to show, offices that it's a big issue in their district and that they should, care about it and want to do something to support their constituents.
Great. Let's see. When do you think this, there's a chance that this could come up for a vote for the Senate, and then if in the Senate, and also when you think Congress would even take this bill up?
Yeah, again, another great question that I'm not too certain, especially in the Senate side. I think they kind of have their own, I'm not too familiar with the way that they, kind of go about deciding what comes to the floor. I think they kind of have their own things that they're, prioritizing right now. And hopefully that the Support Act will be, one of those things that they eventually bring up. But as far as I know, there's no direct, no immediate plans to bring it to a vote at this time. Hopefully that will change though. But in the House side, I think similarly, I'm not too certain what the focus is right now in terms of, upcoming bills. I know that the House is going into a recess, August recess pretty soon. And so as of right now, the main focus has been on different appropriations bills. But I'm not too certain what that's going to look like coming back from the August recess. And so I wish I definitely had a better answer on that front. But I think as of right now, just, it's kind of up in the air for whatever is going to be prioritized to be put to a House floor vote. But to that point, like I mentioned, anything to kind of garner support or add more people to a certain bill is always helpful to kind of make that case as to why it should eventually be brought for a vote.
Thanks, Elizabeth. Thanks. Yeah, I know you don't have a crystal ball, and nobody is predicting right now what's going to go on in Congress in the next couple of months. Wild ride. But Elizabeth, do you have time for one more question?
Yeah, sure.
Okay, so this will be the last one, then we'll let you go because I know you need to go. They wanted to know, has there been any pushback on cost for this bill or any costs associated with it that we know of?
Yeah, not in my experience. Maybe Senator Casey's office has had a different experience, or maybe you've had other conversations, Cindy, where that's been brought up. But at least on my end, luckily that hasn't come up as an issue. I think as the bills were in, it doesn't put a specific dollar amount. in the bill. And so I think that's helpful to kind of avoid any of the pushback on cost, just because there isn't a specific dollar amount associated with it. So I'll say not for me, but maybe, the Senate offices have had different experiences.
Yeah, so I can actually say a few things about cost. The larger bill that we had was estimated to be about $10 million. And so this bill is less than that. The estimates are probably between 5 and 7 million. And to tell you the truth, that is like fairy dust on the national budget. It's like so negligible. It's such a small amount that it really wouldn't impact almost anything. We're talking about trillions of dollars in the budget. So I think cost really isn't something that we need to worry about. I want to thank Elizabeth so much for taking the time to be with us. And, she was just really great and really, really helpful. Let me look and see what other questions people have, and just feel free to put your questions in the Q&A. Somebody asks about a personal story. Sadly, somebody who called in said that their son ended his life because of chronic pain, and it was just so debilitating and so, really, it's really sad. But they wanted to know if it's appropriate to share that with lawmakers. I do think that's appropriate to share with lawmakers. I think that if you see, sadly, on the substance use disorder side, what has really moved people to action, it's been people who have overdosed and sadly died as a result of opioid abuse, and so or opioid use disorder. And so, we have, unfortunately, sad stories on the chronic pain side as well, and people suffer such a great deal. So I do think that telling your story, even if it's sad, is really, really impactful and really important, and, really shows how critical it is for us to do more for pain, because there's so many people that are suffering. So thanks for that question. I'm really sorry to hear that. Let's see. This is a long question. Okay, so somebody is asking, how can factors like co-occurring conditions that they've had as a result of living with chronic pain be taken into consideration in this bill? So there actually is a requirement in the bill that they collect data on co-occurring conditions, which is an important factor with pain, because as you'll see, and you usually find out that people living with pain sadly develop other pain conditions. And so there's some sort of a comorbidity going on with one pain condition often leads to some other pain conditions. Perhaps it's something like central sensitization or whatever. I don't think they totally understand that. But, I think that the bill has factored that in, and we've asked for information on co-occurring conditions. And I think that'll be really valuable to have that information. So it is in the bill, which is great. Another question, how does this bill help people get access to medicine they may need for their pain? So using this data in a lot of ways, I think will help get access to medication you may need for your pain. If you're talking about new medications, I think having the cost information and showing how costly it is to live with pain and not have these treatments and have to go from doctor to doctor from healthcare utilization cost standpoint. So I think that's important. As for if people are referring to the fact that they might have used opioids and can't get access to them now, how will this bill help with that? So I think this bill is not directly aimed at helping people living with pain get access to opioids, but I do think people don't realize that the number of people that are living with severe pain, and that people usually think of opioids for severe pain. What this will document for us is the number living with severe pain and what kind of conditions they're living with. particularly also the co-occurring condition number. Those numbers have got to be huge. And so understanding that there really are a portion of people living with pretty severe pain that need access to opioids, I think will be helpful. So it's not a direct impact, but I think having those numbers will make the case for why pain has such a huge burden. Let's see, any more questions people have? Let's see, who has already signed on to the bill in the House? So the bill only has Representative Nunn and Caraveo on the bill right now. It really hasn't been brought around to the House. So that's why we really like people to really educate their representatives about this bill. You may know that there are thousands of bills that get introduced in every session of Congress, and they can be introduced at any time. And we're like nearing the end of a 2-year session. So this is the 118th Congress. We'll start the 119th Congress in January. So there are thousands of bills. So that's why picking out this one bill is really important, and asking for co-sponsorship of this bill and explaining why it's important is a way to get it recognized and to educate people more on pain. So people want to know, what is the impact of having better data on specific conditions? So I think, again, one of the important things with the data this is going to collect on different pain conditions. So we're talking about, how many people live with cancer pain and what are their demographics? How many people are living with complex regional pain syndrome and what are their demographics? And what are things that help that? Because it's looking at all kinds of factors about individual pain conditions. I think it's only more helpful if we get this information, because more can be done to target policies that affect people with those conditions. And I think it makes a bigger argument for just the sheer number of people living with another condition that maybe perhaps people hadn't heard of. And as I mentioned, as I just mentioned, that one of the things that this bill is asking for is data on the effectiveness of treatments that people have tried. And so if you correlate the conditions people are living with the treatments they've tried, and if we have large samples of people taking this, and this is based on the National Health Interview Survey is one of the data sets we cross-reference against. That is the most reliable survey we have. It goes to like direct visiting with 39,000 households. So it's a very reliable survey. And so getting that data and be able to cross-reference it would, I think, be extremely helpful for finding out what's helping specific conditions. Here's one. How important is it for people not in pain to take action too, like family members or friends, even healthcare providers? So you can forward our alerts to anyone. And so tomorrow when you get this, sending this to friends and family, I think is really important. It is really the sheer number of people that contact Congress about a particular issue that really, really resonates the most. And so the more people that contact a particular office, the more this comes up, they will be more inclined to take action on this, particularly if they're hearing from their constituents. And so, think about it as if you were a representative. If you're a representative and, you care about your constituents because you really do care about representing them, and also because you want to be reelected. If you had 1,000 people call you on one issue, and some of the other issues that were on your desk had no one call, or 2 people call, or 2 people visit about, as opposed to 15 people visit about, I think that they're much more likely to take action when more people contact them. So I would really urge you to get family and friends that really understand your condition, are affected by it in different ways, to also contact their representatives and their senators about this. One of the important things we can do here is, certainly help this bill, but in the larger scheme of things, get more lawmakers educated about pain and how it affects people's lives. So I really want to urge you to do that. One says, I have taken action in the past and never heard back from my representative or senator. Makes me feel discouraged and unheard. Do you have any advice on how to make sure they respond to me? So one of my, the way I would answer that is, first of all, they do get a lot of contacts, and sometimes, you don't hear from them. But I think it's most important to call or to visit. Sending an email is great, but it's just something that people can do really easily, and takes a second, and it's worth doing because it raises, as I said, the more people that do that, the more an office will pay attention to it. But if you call and you speak to an aide and you get the aide's contact information, you follow with the aide, they're more invested in your issue if they hear directly from you. If you visit a district office, so you don't have to go to Washington, every senator and representative has an office in your district, and they're on recess, so they're going to have office hours in the local district. So for the month of August, it'd be a perfect time to call your local representatives or senators' offices and ask to visit. Say you have an issue you want to discuss with them. And you're very likely to meet with an aide, not the representative or senator themselves. But that's just as valuable because the aides, the role of the aides are really to take information that constituents bring to them and to bring them to the representative or the senator. And so it's incredibly valuable, I think, to invest more of your own personal time by making phone calls or visiting to have more of an impact and to know that you're making a difference. Couple of questions here on, let's see, how is the data collected and who's responsible for submitting individual data on patients? So most of this data that they would use for these, the issues that we've reported out are used, they are in surveys already. So what I mean to say by that is that there are large data sets of information that the CDC will use to analyze and cross-reference data. And so what they'll do, for example, is use a large set like the National Health Interview Survey. If you think about it, just on that survey alone, it's like a 45-minute survey. And it has many questions on different things. And it certainly is going to ask all the demographic information and will ask the chronic pain questions. There are actually specific chronic pain questions in the National Health Interview Survey. How long have you had pain? How much does it affect your life? And so they have thousands of pieces of data come back on this, but they can cross-reference and look at any individual that has these specific demographics and see if they answered that question, yes or no, and how they answered other questions on their health. And so they would be able to easily pick up, okay, if they have pain, do they have other recurring conditions? Are they answering yes to questions that ask about depression or about anxiety? And so there's a lot of this information that exists already. It's just taking the time for epidemiologists to actually work with the data and analyze it. And they have, lots and lots of computer models to do that. And so a lot of this information on, for example, utilization of healthcare services is information they're collecting already with large data sets. And there's very clever and creative ways to use existing data. So a lot of this is not new data that they will collect, but cross-reference data in ways that they hadn't before, or analyze it in many ways that they hadn't before. The CDC is likely to only use super reliable surveys that go to thousands and thousands and thousands of people. And so they use the National Health Statistics Center. I think it's called the National Center for Health Statistics is the actual name. It's part of the CDC, although it's located not in Atlanta. I think it's located outside Washington. But this is an organization, a government organization that just collects data on huge amounts of people, data sets that are de-identified. So it's not, it's not like they have somebody's name or anything connected with it, but they have the data to work with. And so the CDC would only really use highly reliable data like that. If you see articles in journals, many times they're doing their own study, and the N, meaning the number of people participating in many of those studies, is small, 100 people, 200 people. It's expensive to do studies and surveys on large groups of people, which is why it's the government that actually collects that super reliable data that would be reported in something like the kind of thing we're asking for. Couple questions on the data. Okay, also, why hasn't this information been collected in the past, considering its impact? And do you have examples of other conditions that are measured in a similar way? Yes, and to how we like pain measured. Yeah, so first of all, the major conditions that everybody knows about and you hear about all the time, and sort of the top three that you typically hear about are diabetes, heart disease, and cancer. And we collect so much data on those conditions. So they're already collected by the CDC in just huge databases because they've gotten so much attention and so much, people just, know that these are chronic conditions or can be chronic conditions that affect enormous numbers of people. And so the government has just made an effort to collect this. Also, advocates for those groups. The cancer groups are really successful. The American Cancer Society is super successful, right, in urging better data collection on the conditions that, are who their advocates and their patients are. The Heart Association is really active. So big associations with conditions that are really well known and well funded have gotten much more attention than pain has. And so that's why this information has not been collected on pain. I think another reason it hasn't been collected on pain is because we tend to be very stovepiped in this country. And so, if you look at the NIH, there's an Institute for Stroke, and an Institute for Diabetes, and an Institute for Musculoskeletal, and there's an institute, for cancer. There's an institute for each individual disease, but pain often crosses many different diseases and conditions. So it hasn't been, in a sense, owned. There's no institute for pain. Similar thing with CDC. CDC does not have a group that just looks at pain. Pain, unfortunately, in the CDC usually ends up in the injury prevention group because it's been associated with opioids, but there's no pain group there. I once tried to do work figuring out who was tracking pain years ago at CDC, and there was no one. I only found one person working in the chronic disease area and one person who had an interest in arthritis that got arthritis looked at, and the Arthritis Foundation is also involved. So arthritis is like one of the only pain conditions that they do collect information on, but not on chronic pain as a whole. And the only way that we have the 50 million and the 17 million number that I talked about, the chronic pain number and the high impact chronic pain number, is because we managed to get 2 questions on a population data report, which is called Healthy People. And the Healthy People 2030 is run out of the Office of the Assistant Secretary for Health. And they have been looking at the number with pain and the number with chronic pain. And so we managed to get questions on the National Health Interview Survey for the first time in 2016. And those have been repeated like every 2 years. And so we do have those 2 questions. And typically we get that information back on those 2 questions. So we know that the 50 million number with pain and the 17, or it's been between 17 and 20 million with high impact chronic pain, are highly, highly reliable numbers. So those are numbers you can quote, and there's no questioning those numbers. Those numbers are coming directly from the National Health Interview Survey and that data set, which is super reliable. And so that's really the only solid information that we have and that we get repeatedly from CDC. So that's why, you know, we're trying to make such an effort here to get better data. Let me see if there are any other questions. Is the youth risk behavior surveillance system one of the existing data sets that would be used? That's interesting. You know, I don't know. First of all, this is focused on adults, you know, not pediatrics or not youth. So adults are over the age of 18. I think there could easily be a component added for youth and the behavioral health, it's called the Youth Risk Behavioral Surveillance System. So, you know, it would be important, I think, for us to ultimately add that if we get this, so that we can track youth and pediatric pain. But it hasn't been included as part of this bill. This asks, would this research include results of alternative treatments or approaches to pain management? So one of the questions that this would require CDC to report on is what treatments people have used and what treatments people have found effective. So we're, you know, in that, it is likely that we will be able to capture information about what complementary treatments people have used and what they found effective. And so I think we will get that information from this bill. Let's see. I think that's all. If anyone else has any questions, put them in the Q&A because I am getting them sent to me. So let me just see if there's anything that I've missed. I was asking, can I share the bill title again? The bill title is Advancing Research for Chronic Pain. And let me just see. Okay, so here's one. When contacting legislatures, should we be making the connection to treating pain as prevention for substance use disorder or relapse, or just talk about severe pain? You know, obviously do however it impacts you or however you feel about it. I think it's really important for us to make the distinction and to like really emphasize pain independent of opioid use disorder. That's what this bill really does. It's focusing only on chronic pain, not on opioid use disorder or not on substance use disorder. There is a question about, you know, co-occurring conditions, and so that could potentially come up. But you know, I think you would be better off in not focusing on substance use disorder for this bill. That this bill really is a chronic pain bill. It is not an opioid use disorder bill, you know, in any way except potentially, you know, collecting co-occurring conditions. Let me just see if there are any other questions that I missed. I think I've gotten everything. So thank you so much for joining today. I hope this was informative. And tomorrow is our virtual advocacy day. So really want to encourage you to use this hashtag, tell Congress to count pain, or this hashtag why pain counts, so that we can get lots of attention and you know, pick up on this tomorrow on social media. And please do the emails, call your representatives. It would be really great to do that tomorrow. And we're really hoping that you will. If you go to the US Pain website and look under programs, we have the Advancing Research for Chronic Pain Act as an option. If you click that, you'll be able to see the ways to be able to take action. And at 12:01, it'll all become active. So tomorrow, if you can take the time out, maybe like, 5 minutes every 2 hours or something to send a tweet or send, an email, or to even call your representative's office, ask for the health policy aide or an aide that handles health issues. That would be great. Really appreciate you doing that. And really, thanks for joining, and hope we make a big impact tomorrow.